Is semaglutide safe? Semaglutide is the anti-obesity medication known as Wegovy, or the type 2 medication for type 2 diabetes known as Ozempic. It's being used widely, and so much so that between 2022 and 2023, it was estimated that 3.2 million Americans were using this medication, both the injectable version and the oral version. So, a great recent article in the Annals of Internal Medicine collected data from emergency department visits and found 551 cases, and then extrapolated that data, meaning that on average, if within these certain number of emergency departments, if there were 551 visits to the emergency department because of a complication with semaglutide, then that meant overall in the United States, in total, about 24,000 emergency department visits were made because of a complication or side effect from the use of semaglutide. Then they really looked at the data to see why patients were going to the emergency room for complications with the medication. Most of them were gastrointestinal side effects: nausea, vomiting, diarrhea, constipation so severe that they needed to go to the emergency room. 1% of those patients had pancreatitis. 1% of those patients had some sort of gallbladder issue. Hypoglycemia or low blood sugar was also seen, but this vast majority of the time was seen when it was used in addition to other diabetes medications. In the end, they felt like for every 1,000 users of a semaglutide injection or oral medication, there were about 4 people that went to the emergency room for a complication or side effect to the medication. So at the end of the day, yes, there are complications that happen with any medication, but overall, semaglutide does seem to be relatively safe. However, gastrointestinal side effects, nausea, vomiting, diarrhea, constipation, and even lesser risks of pancreatitis and gallbladder issues can be seen with these medications. So if you're having those complications, please talk to your doctor or go to the emergency room.